So good afternoon, everybody. It is great to be here. It's great to be outside where people can mask if they want, but not if they don't want, which is good. And I think this is the first that I've been to of a real State of the School of Public Health address. It's great to see you in person. It's been a long time since I've had the opportunity to be together at an event with faculty, staff, alumni, friends of Brown. This may be the first event of its type that I've been to for how long? Year and a half? It's been a long time and counting. So my job today is actually simple but really pleasurable, which is I get to introduce the Dean of the School of Public Health, Dr. Ashish Jha. And it's hard to believe that as of September 1st, so not very long ago, Ashish has been dean for exactly 1 year, which is great. Now, I have to say just a little bit of backdrop. When the School of Public Health was really in its infancy, and I know it has this long and distinguished history of being a program in community health within the med school, came out, its own school, a great success from the very beginning due to the hard work of many people, many faculty. I see people in the audience who are very involved in that. The world was not as attuned as it might have been to why public health is so important. Something I don't have to convince anybody in this room of, but the world wasn't as attuned. And I remember a story of meeting with somebody who I hoped would give significant financial contribution to the School of Public Health. That's part of my job as president. And I started talking about it, and this person looked at me with this deep confusion saying, oh, okay, but what is public health? So needless to say, I did not get the support that I was hoping on. I did from that person just about a year ago, where it was like, okay, now I know, and I reminded him of this conversation. It's like, now I know what public health is. Now, we all know in this room that public health is, yes, it's about pandemics and it's about infectious disease, but it's about so much more than that. And over the past year, we've learned, I think, much more than we ever thought we needed to learn about pandemics, but we've learned about healthcare systems, we've learned about economic and social disparities in health outcomes. All of this work has become evident, opioid addiction, which I think we knew was a problem before the pandemic. But I've been gratified to see this growing realization of the importance of the field that all of you are involved in, and of just the breadth of the field, but also the interrelated connections between different areas of the field. And I say all this by backdrop to introducing Ashish, because his career and the work he does really exemplifies the kind of work that is the best of great public health research and education. So, you know, when Ashish agreed to come to Brown, the pandemic was just beginning to unfold. And it became very clear very soon how great it was to have an expert on pandemic preparedness and response, as well as health policy, research and practice here at Brown. So I'm going to say a few words to all of you, but you may know all of this. Maybe I don't need to. But Ashish has done extensive research on improving the quality and reducing the cost of healthcare, really important work. You may have seen him on a news program or two recently, I'm not sure, maybe. And over the last year and a half, for those of you to whom, you know, he's a new somebody you know more recently, he's become a trusted voice of reason on the pandemic, helping to break down misinformation about how the virus spreads and safety and efficacy of vaccines and the most public health policies. And he's done this in a really savvy, incredibly informed, but also very down-to-earth way that I think exemplifies how public health communication has to happen if we're really going to make a dent in health behaviors and health policy and things like that. So his leadership of the School of Public Health and the work that many of you do every day has been exceptional. You know, he's working with a great group of people and bringing them on. Under his leadership, and thanks to the high visibility work of public health and medicine scholars, many of whom are with us today, applications to the MPH program have more than doubled, with the biggest surge from prospective students of color, which is really, really great to see. And meanwhile, the school has risen in the ranks of NIH research funding, so we're now 5th among all schools of public health. That's really terrific. Thanks to the work many of you are doing each and every day, you know, you're fostering collaboration. You're making important advances in areas from Alzheimer's disease to opioids to veterans health to mental health, and I could go on, and I'm sure we'll hear some about that from the dean. So I am thrilled, and I think we're all thrilled in having such an accomplished scholar, academic leader, global health advocate, representing Brown and leading the great School of Public Health here at this university into a very, very promising future. So with that, please welcome Dean Ashish Jha. Thank you.
President Paxson, thank you for those words and really for your extraordinary leadership over the last year and a half. Chancellor Menkoff, Provost Locke, members of the corporation, faculty and staff colleagues, alumni, students, friends, my fellow public healthers, all of you. As President Paxson said, we are in a public health moment. Here we are, right? Open tent, socially distanced, many of you wearing masks. That's because we meet in a world still fighting a pandemic. And in this fight, we face a whole host of very powerful opponents. The virus, SARS-CoV-2, is only one among them. Now, to be sure, COVID is a deadly killer. But COVID has also been a lens through which we have learned so much about ourselves and about our country and about our world. It is a lens into the enormous courage of healthcare workers, doctors and nurses and others, often without the equipment they need to be safe. It is a lens into the genius of a global scientific community who collaborated and translated decades of discovery and science into a vaccine that is saving millions of lives today. It is a lens into the best of people, friends and families supporting each other through illness and death, lost jobs, lost wages, lost homes, and lost businesses. And it is a lens into great leadership, like when universities find ways to keep their doors open in the middle of a pandemic and keep their communities safe, their employees secure, their educational mission intact. I think COVID has revealed the very best of us. But you know where I'm going. COVID has also revealed the very worst of us. It has exposed what we've always known, but have never fully acknowledged. COVID has laid bare the deep racial inequities in our society. We may all be in this together, but let's be honest, we're not all in this together equally. The pandemic has had a devastating impact on communities of color because these communities bear the burdens of systemic racism, a racism that saddles people with jobs that can't be done from home, housing that isn't conducive to social distancing, chronic diseases and poor access to healthcare services, burdens that make COVID even more deadly. COVID has exposed the weaknesses of our national public health system and the inability of that system to meet the urgent challenges of our time. Whether it's data collection or testing or tracing, or even the ability to get millions of people vaccinated. We don't have the public health system we need, And we certainly don't have the public health system we deserve. And COVID has exposed weaknesses in our global health architecture, right? After all, this is a global pandemic. Yet most of our actions rarely seem to acknowledge that simple fact. From our inability to get oxygen to people in India, to our inability to get vaccines to large parts of the world, the inequitable response to this pandemic, I think, will go down as one of the greatest calamities of our time. We are now at a point, today, September 1st, 2021, we are at a point where if we wanted, we could prevent nearly every death in the world from COVID. We have all the tools, but not the will. And that's the moment we're in. COVID has exposed the terrible cost of science denial, right? When we needed data and evidence. And it's not just the political leaders who kept saying, you know, COVID's gonna simply go away. It was an entire echo chamber that refused to recognize the threat, that politicized the very simple act of wearing a mask, that continues to amplify arguments about dangerous and phony cures. And last but certainly not least, COVID has exposed the power of social media platforms like Facebook that enable endless streams of misinformation and disinformation. Now, let's be clear, what they spread is not random noise. It is well-crafted and strategically aimed to confuse when clarity is needed most. We are in the midst of the most important public health moment of our lifetimes. A moment that demands more of us. A moment that makes plain that business as usual, the way we've always done things, can't continue. A moment that demands that we think differently and that we act differently. But, to paraphrase the great Lin-Manuel Miranda from Hamilton, this is a time that demands that we turn a moment into a movement. Acknowledge the moment, surely we have to do that, but turn it into a movement. The movement where we lead, the movement where we confront the crisis head on. Because as Lin-Manuel Miranda goes on to say, history has its eyes on you. History has its eyes on all of us. Now, as a school, we have important and urgent opportunities to confront all that the COVID pandemic has laid out in front of us. Because you see, throughout history, pandemics have opened a window for action that wasn't open before. And how we choose to act is up to us. I believe we can now more aggressively confront structural racism by investing in communities of color and by bringing more diverse voices into the rooms where decisions are made. We can build a public health infrastructure, a public health system that meets the needs of all our people. We can forge the kinds of global partnerships built on mutual respect and cooperation. And together, we can make the Brown School of Public Health a place that enables all these changes. So how are we going to do this? Well, first, it begins by making sure we are a place that is open and nurturing and supportive. But second, I believe we have to stretch the boundaries of what is public health. That means embracing scholars and practitioners who share our goals and our values, even if they don't share our titles. We have to create a public health school deeply engaged with the world and deeply engaged in solving the big problems of our time. Now, the journey to this moment has taught us a lot of lessons, and I want to share just a few. I suspect all of us, whether you're a student or a faculty or an alum, all of us are here today because we fundamentally believe that through data and through science, we can make the world a better place. I believe that. But this pandemic has reminded us that while the science of public while the science of public health is essential, having a loud microphone is even more important. No. While the science of public health is essential, it alone is not enough. Reaching people, changing behaviors, provoking action, they require more than sharing knowledge, right? They require understanding what people value and what people find meaningful. By the way, our behavioral science colleagues have been telling us this for years, and I think it's finally getting through. Another lesson is that we have learned that some of the best public health science can come from people completely outside of public health. When I reflect on the last 18 months, some of the most critical insights of the pandemic have come from sociologists, economists, computer scientists, historians, to name just a few. And a third lesson is that solving hard problems, like how do you build, test, produce, and deploy billions of vaccines in short order? How do you do that? Well, it requires unprecedented collaboration among the brilliance of scientists, the innovation of private industry, and the strength of government. So maybe the most salient lesson of this pandemic is also the most obvious, which is that at the end of the day, the hardest and most important problems are solved when people from different backgrounds, different disciplines, and different lived experiences come together and work together. And that is why I am so excited to be at Brown University. Because we have an opportunity to transform public health that I think maybe no one else can. Because, let's be honest, everyone talks a good game about being multidisciplinary, but Brown actually is, right? Our structure, our size, and most importantly, our culture actually nurtures and rewards multidisciplinary collaborations. This is why I believe we are the public health school that can turn this moment into a movement. Over the past year, I think we've begun doing just that. So let's talk about the last year and what we have accomplished. I think we have made big strides in building even a stronger and even more impactful public health school. And we're doing it together, all of us, right? So on my first day, exactly a year ago, on Zoom, because we couldn't do this a year ago, right? I shared 3 big challenges that I said must be part of our priorities. Preparing and responding more effectively to pandemics. That was number 1. Understanding the health effects of climate change and getting the world ready for an unsteady planet. And number 3, harnessing the data revolution. And in each of these 3 areas, we've made really great progress. Our global epidemics website and dashboards have been sought out by millions of people for information about the state of the pandemic in the US. I hear all the time from people around the country when talking about what data do you use to figure out what's going on, and people say, go to the Brown School of Public Health Global Epidemics website. I love that. Our faculty are doing seminal work on health misinformation and how to counter it. And in this year of so much confusion and disinformation, we've worked really hard to rebuild trust in science and expertise. Because misinformation isn't just a problem in fighting a pandemic. It is a roadblock to the success of every public health intervention. So we've begun treating misinformation like any other science problem, and started training current and future public health leaders to be more effective at fighting bad information. And we're not going to do this alone. We've started building important relationships with the Rockefeller Foundation, with the World Health Organization, to drive this work forward. On climate change, we launched a huge new series of educational programs, or new educational series with IBIS, on how climate changes health. We've brought in some of the leading scholars focused on the intersection of climate change and health. And we are learning that climate change is a critical threat that we have to confront head on. And in this past year, we launched a new school-wide initiative on data science, both to generate new insights, but to also serve the community's growing hunger for harnessing the data revolution. Now, this has all been really important work. But to meet this moment, to lead this movement, we have to make sure our own house is in order. And over the past year, the school has renegotiated its relationship with the university. The new arrangement gives us substantial financial independence. Now, let me be clear about one thing that I believe deeply, which is the biggest strength of the Brown School of Public Health is that it is part of Brown University. There's no doubt about that. But the new financial arrangement means that we have the tools we need to create a fiscally strong school for the long run. Because you can't turn a moment into a movement if you don't have a strong foundation. Now, we all know that building a strong foundation isn't easy, and we've had to make some tough choices. These choices have moved us out of some dangerous financial waters, but they've also been painful, I know. Thankfully, we've had great partners in the university who are clearly committed to the school and clearly committed to public health, and for that, I am really grateful. With this new arrangement, and with the commitments of the university, the school can begin to make the kinds of investments we need. Right? Investments in our people, in our ideas, in our capabilities, in our physical spaces. The resources we bring to the school will be further invested in our excellence. And the heart of that excellence, of course, is our people, all of you. All of those much needed resources will go to better support our faculty and our staff and to provide financial aid to our very talented students and very talented and inspiring students. And what's really funny, as we were doing all of this, I have more and more people coming up to me and saying, boy, Brown has one of those really very dynamic schools of public health. I'm like, we do. And you know why people say that? Because we do. We're doing extraordinary stuff. More and more people are learning about what we're doing. The word is getting out. And this is not just me standing up here and praising we have an awesome school. We do have an awesome school. But as President Paxson laid out, we saw this dramatic increase in the number of people applying to nearly every program of the School of Public Health. This meant we were able to grow our class with the highest caliber students. I love the fact that more and more people want to come to Brown. But what really made me proud about being here, and President Paxson alluded to this, was that applications from people of color increased almost 150%. 150% in 1 year. And that's because people vote with their feet. People know that if they come here, they can thrive. Increasingly, we are becoming the place where people from all walks of life join us, invest in their public health education, and become part of the movement to make health better. Now, I have one big shout out. I am really proud to announce that under the extraordinary leadership of Dean Melissa Clark, now it isn't official yet, so I don't know if I can say it, but I'm going to say it. The Brown School of Public Health is going to soon be reaccredited for hopefully another 7 years. It really demonstrates confidence in what we're doing and our ability to do it at the highest standards. Now, we did the whole CEF reaccreditation thing virtually. Now, we did so much in the past year virtually. And from that, we learned we can do all sorts of things in different ways. We can work differently. We can teach differently. And we can do those things without compromising quality. So, with that lesson learned, we've been working pretty closely with the Office of the Provost, Provost Locke, Provost Prashad, and with their support and with their investments, I am excited to make an important announcement today. I am excited to share that our school will be launching a new online MPH in the fall of 2022, in just 1 year. Now, I know a lot of you are probably feeling like, boy, that's really ambitious. In 1 year. But you know, I think we're a school that can do hard things. And we're not doing this just because it's hard. We're doing this because it's really important. The pandemic has taught us that the global hunger for public health education is immense. And I believe it is our moral obligation to ensure that we share our knowledge with others to improve global public health. That is part of our job, it's part of our mission. And the new online MPH will help us do just that. It will become a flagship online-only master's program for Brown University. It will give people around the world access to our school, to our faculty, to their wisdom, and to their knowledge. It is a commitment to education, of course, but it's also a commitment to equity, and it's a commitment to expanding opportunity. We need to be the school where people feel the benefits of our education, whether they ever set foot in Providence or not. You know, as I reflect on the images from the last 18 months from this pandemic, there are so many that will shape our understanding of the moment we are in. But for me, there is possibly none more vivid or one that is any more searing than the 9-minute, 29-second video of the murder of George Floyd on the streets of Minneapolis. Racism isn't new to our country. It's older than the nation itself. And the struggle against racism is also not new, right? Every generation has given us new leaders ready to fight for justice. And in the shadow of the violence in Minneapolis, inspired by a new generation of young leaders, we created and launched the Health Equity Scholars Program. Now, we work pretty closely with our longtime partner, Tougaloo College in Tougaloo, Mississippi. And this fall, like in a few short days, we will welcome our first full cohort of 12 scholars. Now, these are pretty extraordinary men and women from around the country. They come to us with big dreams. They also come with the ability to make those dreams a reality. I want to make a promise today. These people, these scholars, these leaders, they're going to change public health. And I am so excited about these scholars that if you'll indulge me for a minute, I want to tell you about 3 of them. I'd love to go through all 12. I really would, but I'm going to just pick 3. Megan Ford majored in biology at Jackson State. She's been studying COVID-19 among African Americans while also doing research in pediatric oncology at the National Cancer Institute. Her goal for coming to this program? To improve the health of people in underserved communities by focusing on community-based programs. Malik Mitchell majored in chemistry at North Carolina A&T. Now, he says the fact that Brown created a program like this says a lot about Brown. In my community, he goes on to say, a lot of students don't see role models that come from places where I come from going to a school like Brown. Malik wants to be a clinician, a doctor. He wants to provide clinical care. But what he also wants, and this is using his words, is he wants to inspire community. Kiara Lee is from Coldwater, Mississippi. She was a biology major at Tougaloo. She comes to Brown to learn how to address a major injustice in American healthcare today. And I know many of you know this, but African American women are dying at unconscionable rates during pregnancy and childbirth. And Kiara is here to get the tools she needs to urgently change that reality. These are just 3 of the extraordinary group of scholars. And to the other scholars I did not call out by name, I am sorry. You're all extraordinary individuals. And I have to say, I feel incredibly proud just to be part of the same institution as all of you. So the goal of the Health Equity Scholars Program is simple and ambitious. I believe if you want to address systemic racism as a public health problem, you've got to change the face of public health leadership in America. These scholars represent that change. They are a structural intervention into the heart of America's public health system. This is an effort to change who gets to sit around the table when the big decisions are made. Who gets to be in the room when those decisions are made. Because only then will the decisions that get made meet the needs of all of us, not just the privileged few. This transformation of public health begins with this class and continues with the classes that follow. And it will take time, but make no mistake, it will happen. And public health is going to look meaningfully different a decade from now because of these scholars. And this is how we begin to turn a moment into a movement. By enabling the best and brightest in our country. Not just our great health equity scholars, but the incredibly diverse group of future leaders who have chosen to come and study at Brown. By enabling those who have talent and passion, but not always opportunity. Now, of course, our efforts at diversity, equity, and inclusion need to also include our faculty and staff. When I started a year ago, last September, we released our anti-Black racism plan. It was built in many ways off of the university's plan, but we made some specific commitments at the school as well. One such commitment was that we said in 5 years, we'd double the number of tenure-track faculty from historically underrepresented groups. And that each year, the plan lays this out, says each year, we would report to the community on our progress. And then the plan said, me, the dean, needs to be personally held accountable for progress. This is not the job of someone else. It's the job of all of us, but I need to be held accountable. So here I am with our one-year report. Over the past 12 months, we grew our ranks of tenure-track faculty from historically underrepresented groups by 60% in 1 year. Progress. We have lots more work to do, but we're moving forward. And of course, we know this is not just about having more diverse voices. It's also about having an inclusive culture that creates a sense of belonging. And here we have sought out counsel from one of the leading experts on health equity, a colleague, a leader in the country, Dr. Uche Blackstock, and her organization, Advancing Health Equity. Dr. Blackstock and her team are taking a deep dive into our school. Their goal? Figure out what's working and figure out what's not. And help us build a school where diverse voices thrive and where diverse voices lead. It's going to be an important journey, but one we are committed to. Because you see, if we're going to solve the big public health problems of our time, it's very clear we need a diverse team of scholars, teachers, and practitioners. That, too, is how we turn a moment into a movement. One more thing. Before I started last year, I listened to your concerns, and I heard clearly that we had a two-tier system that treated tenure-track faculty and research-track faculty differently. So we began to take corrective action to create more parity across our faculty. And that means that we will absolutely continue to support our tenure-track faculty, but we will also support other members of our community. So this past year, we added an increased salary support for research-track faculty and are providing equitable access to other funding and support. And while we still, again, have a lot more work to do in this area, we are making progress towards ensuring we don't have a two-tier system. Sorry. Now, the work to strengthen our school is fundamental, right? Especially at this moment. But so is recognizing that we have to be part of a vibrant community. Beyond the great community of Brown University, we are part of Providence and we're part of Rhode Island. And so as a school, we are redoubling our efforts to build ever stronger ties with our community. Now, there are a lot of long-standing collaborations we have, like the one with the Rhode Island Free Clinic, where our students and faculty engage and learn from this terrific model for how you provide care for people, irrespective of their ability to pay. The school partners every year with the Blue Cross Blue Shield of Rhode Island to create the Rhode Island Life Index. This is an annual survey of Rhode Islanders' perception of their health and their well-being. It's really important work, actually, because at the end of the day, our work, the work of policymakers, has to ensure that it is driving improvements in how people perceive their own health. We're building on our long-standing relationships with the Rhode Island Foundation, an organization that is deeply committed to improving the health of the people of our state. Now, the foundation is leading critical efforts to ensure community voices are prominent as we move towards having an integrated academic health system. And we are working with the state of Rhode Island, the first state in the country to authorize supervised consumption sites, to try new approaches to reduce drug overdoses and deaths. We are committed to being a steadfast partner to our Providence and Rhode Island communities, because you can't build a movement if your community isn't thriving. In all of this work, we are starting to get new support. In fact, in the past year, we set some new records I want to share with you. Total giving to the school's annual fund increased 56%. The number of donors who gave to the school increased 67%. In fiscal year 2020, our school raised $6.2 million. In fiscal year 2021, the one that just ended this June, we raised more than $29 million, a five-fold increase, and a record for what our school has raised in a single year. All of this is to support our work on pandemics, climate change, faculty chairs, student aid, and our great health equity scholars. This support will allow for critical investment in our people and in our priorities. And our work, the priorities that we are pursuing, it's inspiring others, people who share those priorities. And they are learning that our school is a pretty smart investment, because we can turn resources into real-world returns for our community, for our country, and for the planet. And our growing base of supporters are helping us turn this public health moment into a public health movement. Now, I want to take a little bit of time to talk about the road ahead. But before I do, I'd like to just take a couple of minutes to thank some folks. I want to first of all start out by thanking all of you. You know, it's not easy welcoming a new dean in the middle of a pandemic that you've never even met. But many of you signed up for my twice-a-week walk with me as I explore Providence, and I'm grateful for that. Many of you participated in the town halls that we did. You came to my Ask Me Anything sessions. You came to my Tell Me Anything lunches. You've all been incredibly generous with your time, your patience, as I have learned, and your advice. And for that, I am grateful. I am also grateful for a president and a provost who are the models of great academic leadership. They really are. They're extraordinary. And I'm grateful for their mentorship of me and for their steadfast support of the school. And at the school, I have to start off by thanking our staff. They get way too little acknowledgement for the work they do. They work tirelessly to support the academic mission of our school. They make this place run, right? The staff make the whole place run. And they do it seamlessly, and they do it selflessly. It's amazing what our staff pull off. Now I want to call out a few specific groups. One is university advancement. Thank you for committing to finding support for our school, sharing our stories with Brown supporters. Thank you for elevating public health. Now I know that building relationships over Zoom is not the easiest thing to do. And so I'm really grateful to the advancement team for what they did. There's another group that I think gets way too little attention that needs to be called out. And that's Brown University Human Resources Department. Because they took on the Herculean task of enabling testing. If you saw the operations, you know how hard this was, how complex it was. They made it possible for all of us to remain safe during the pandemic. Now, to my fellow faculty members, thank you for your incredible work over the past year. This has been the most difficult of years. You had to manage a pandemic, you had to manage a new dean, and you had to manage all the changes that we had to make. And thank you for doing it with such grace and such poise. Your dedication to creating, sharing, and promoting knowledge, your commitment to educating the next generation of public health leaders, it inspires me, it's inspiring our supporters, it's attracting new students, and it gives me faith that we are the school that can meet this moment. Now, one personal thanks I have to give, and that's to my two predecessors, Deans Fox-Weddell and Bess Marcus. They have consistently given me sage advice and provided guidance, and were willing to jump in on multiple occasions and help when I needed it. So thank you. I want to finish by giving a big thanks to our students. Thank you for choosing public health. It's really an extraordinary field. It's a lot of fun. Your energy and your intellect, combined with a little training that we're going to throw in, it's going to improve the lives of millions of people. And most of them will never know. They'll never know that it was your work that made them healthier. And you know what? It's okay. That's what we do in public health. So the past year has been pretty crummy. I think we all agree. Be happy to not have another year like that. We have faced extraordinary challenges. We still do. But we've made progress. And in the year ahead, we are going to do so much more. We're going to launch a pandemic preparedness center and recruit a world-class scholar to lead it. We will redouble our efforts to counter misinformation and disinformation and make Brown School of Public Health and Brown University one of the leading places in the world that studies misinformation, that understands it, and that knows what to do about it. We're going to build the scientific basis for understanding this public health challenge, and we're going to train a whole generation of public health leaders who know how to combat it. This year, we are going to bring in faculty to lead our work on climate and health, arguably the most important issue of our time. You know, the health effects of climate change are all around us. I mean, even Ida, right? The outer bands of which are causing the rain right now. Climate change doesn't cause new storms to come up, but it makes them much, much stronger. And these devastating storms don't just cause damage and immediate loss of life. You're going to hear statistics on TV, 8 people have died from this storm. Actually, the biggest effects of these storms is that they disrupt health systems and public health. They make it impossible for people to get the care they need. Their effects can last years. We need to do the fundamental work of laying out how climate change is already harming health. And we must build resilience into our communities to withstand what is coming. This year, we're going to strengthen our ranks in data science and our capacity and infrastructure to make Brown School of Public Health a leader in combining data with public health. And we're going to do that work in data science in close collaborations with the university and the terrific colleagues we have there, including a fabulous new leader of the university's data science initiative. This year, we're going to relaunch the Hassenfeld Institute under new leadership. Now, those of you who've been following the Institute know it's been doing extraordinary work over the last 5 years, tackling obesity, asthma, and autism. Over the next decade, the Institute will dedicate itself to a simple yet powerful goal: to eliminate disparities in health for the children of Rhode Island. Not reduce disparities, eliminate them. Because if there's one thing that I suspect all of us agree on, it is that every child born in the Ocean State, whether that child is white or black or brown, born to parents who are rich or who are poor, deserves a chance to grow up healthy and strong. And that is what we absolutely must enable. Rhode Island is our home, and it must always be first in our efforts. But we can be both local and global. And so this year, we will further our commitment to be a more intentionally global public health school. What does that mean, and how are we going to do that? We're going to be launching new programs and activities that engage a global community hungry to learn and do public health. We will recruit faculty whose work will shape a field of global health deeply changed by this pandemic, where the notions of partnership and collaboration are at the heart of the work. And we're going to do it by building strong ties between our school and our university and organizations like WHO. And one organization that I think has been a stalwart in this pandemic and has been a beacon for how you do public health at scale, and that's the Africa CDC. We're going to start working with entities and organizations like that. But as we do these new things, I want to be very clear, and I want to promise our colleagues and friends, we will not forget how we got here. This is maybe a relatively new school of public health. We have a very strong tradition of scholarship. And that means we will make more investments, we will redouble our investments in world-class activities that allowed Brown to become a leading public health institution. From our cutting-edge work, illuminating the science of mindfulness, to life-saving work on aging and substance use disorders, to understanding how the science of implementation will help us be a more effective public health community, to so much more. We're going to further strengthen our methodologic backbone by recruiting senior scholars, more senior scholars in epidemiology and biostatistics. We will seek out another generation of leaders to join us in the Health Equity Scholars Program. And we will engage more deeply and more widely with our supporters to build the financial backbone of a school fit to take on the big challenges of the 21st century. And this is just the beginning. I am so excited for a great year ahead. But I want to finish off with some sobering words of the challenges as well. Turning this moment into a movement is not going to be easy. The world will no longer tolerate an academy that doesn't feel relevant to the real-world problems faced by ordinary people. I think public health, by transforming itself, can be a vision for what that academy can be. An academy engaged, effective, impactful, yet deeply scholarly. I have no illusions about this, right? The transformation of public health that is needed in this pandemic and coming out of this pandemic is going to be pretty hard. And as we look ahead, a few things are pretty clear. There's no obvious set path. There's no, if we just do this, we're going to get there. So that means we have to forge our own path. And we have to forge our own path because the rules of public health have changed over the last 18 months. The priorities of NIH, I promise you, are going to change radically over the next few years. What our students demand of us will change. What our supporters demand of us will change. What our state and our country expect of us will change. That means that the path we build together is going to be bumpy and curvy, and it's going to test us. It's going to force us to reach beyond our comfort zone. Because as I started with, this moment demands more from us. But if we meet the challenges of this moment, if we build this unforged path together, I am 110% confident we're going to find ourselves in a better place. A place where we can raise expectations for what a school of public health can do. Our community, our state, our country, our globe demand that we lead through this pandemic and beyond. As those committed to advancing the public health against all threats, we need to become the globe's essential workers. And the one thing I have learned over the last year is that there may be no place better in the country or in the world, there may be no place better to meet this moment than Brown, to prepare for the public health crises we face and for those that are going to come, by preparing our students, but also by preparing ourselves. It is such a privilege and an honor to be a part of this dynamic and wonderful community. Thank you again for welcoming me with your open arms. I am grateful for all the time you have taken, and I look forward to our journey together. And thank you for all you do for public health. Be well and stay safe, and thank you.
Thank you, Dean Jar, for sharing your vision with us, for your tremendous leadership in this pandemic. My name is Stephanie Friedhoff, and it is my distinct pleasure today to ask you some questions. We had lots of questions from the audience. And the first one comes from Denise Marte, who's an ER physician and a Brown trustee, and she would like to know, or he would like to know, apologies, what opportunities do you see for strengthening relationships with the medical school, both at the faculty and the student level?
It's a great question. Public health has been on a funny journey. For the last 20 years, 30 years, we've been saying we're not medicine, we're our own thing, we're different. And we've been spending all of this time trying to explain to people how we're separate from medicine. And I think the last 18 months has made us all realize how artificial that is. So I think that you can't have a great public health school unless you are deeply engaged with medicine. Take the biggest, most impactful public health intervention that we've had in the last 18 months, vaccines. Is that a public health intervention or is that a medical intervention? Where did it come from? How did it come together? It was public health people and medicine people, scientists working together. I can name one after another. All of the big stuff requires more and more close collaboration, certainly among faculty, but also I think among students. I see immense hunger for medical students to learn public health, and I see immense hunger in the public health student community to understand the fundamentals of medicine. So I look forward to new leadership that's going to be coming. Dean Elias has been a great partner, and I'm confident we'll have another great partner in the next Dean of Medicine, and lots to do together.
Thank you. Our next question comes from Jasmine Powell. She's an undergrad student and would like to know, are there plans to strengthen the undergrad program and provide more opportunities to specialize?
Yeah. So there are many, I've talked about all of the great things about Brown, and Brown is an extraordinary place. One of the things that for me has been a total joy is that we have undergrads in public health that didn't exist in my previous institution. And, when I first heard about it, I thought, undergrads in public health, how does that work? I've learned how it works. It's extraordinary. These are these young individuals. I was almost going to call them kids because I have kids of that age, but they're not kids, they're young men and women, are talented, they go out and they change the world, whether they become public health experts or they go do anything else in their lives. I think the opportunity to make sure that they learn the basic tenets of public health is probably the biggest privilege and opportunity we have as a school. So I love the fact that the number of undergraduates concentrating in public health has been rising steadily. I suspect that will only continue, and it is absolutely our obligation, our mission, to meet the needs of undergrads. And the issue of specialization has been on our topic and something we've been thinking about. How do we allow undergraduates to hone in and develop even more expertise? And that is very much a work in progress.
Thank you. We have a question from one of our health equity scholars. How can the US learn from other nations in responding to this pandemic and future ones?
So here I am saying to all of you, this is a global pandemic and we got to act more like it. And then I spend most of the time talking about what are we doing in the US. We all fall prey to these things. It is a fabulous question. The short answer is there's a lot we can learn from other countries. There are a lot of countries that have done an extraordinarily good job. What are the major lessons? One is they've done a much better job countering disinformation. And we have got to figure out how that happens, because misinformation and disinformation, these social media platforms, are global. And yet they've stuck in some countries and some cultures, and much less so in others. We've got to learn and figure out why that is. Second is countries don't split up public health and medicine in the ways that we do. There are fundamental features of a public health system and a medical system that are far more integrated in many other places. And I think that makes a really big difference in our ability to respond. And third is we have massive investments in medicine, right? The healthcare system costs us almost $4 trillion a year. And a tiny sliver of that goes into public health. That mix is very different in other places. So there's a lot to learn as we pull out of this pandemic and as we start thinking about what is the public health system and the healthcare system we want to build. There are plenty of models, and not necessarily always of high-income countries, by the way. I mean, there are high-income countries that have done a great job, like Taiwan, Singapore, but there are places like Vietnam, which is not a super wealthy country, that in general has done a great job. And then, of course, countries like Germany and other places. So there are many places we can point to, lots of lessons to be learned.
Now, maybe the most important question of today is, what is your favorite Hamilton song, and can you sing it from beginning to end?
No, I do have a favorite one, but I am not singing anything. So look, I get one prerogative as dean, and that is to not sing any songs from up here.
But what is the song?
Alexander Hamilton. I mean,
Alexander Hamilton.
Yes, like the
Not the room where it happens?
Oh, that's a pretty good one too, right? And then I'm not giving away my shot, which feels like it's particularly relevant in the context of a vaccine-laden world, right? So there are several that are really good, but yeah, the opening song is like pretty powerful.
Well, let's give the dean a round of applause, and I don't know if there's shots in the back, but...
Thank you. Thank you. We do have a reception in the back. Please join us. And thank you all for being here. And again, thank you all for everything you're doing for public health.